of the urine. Oh, exactly. Okay.
So if you pick up things that are not supposed to be in the urine, it means there's an issue.
It will indicate that there's something wrong with the kidney.
Exactly.
All right. Okay. So let's talk about the treatment and the management. First things first. I know that you already clarified that kidney disease is not necessarily hereditary. Maybe certain lifestyle common within the family can cause members of the family to have the condition. So let's talk about the treatment and the management of kidney disease. First things first. Is this a curable condition? It is curable.
Yes, it is.
Okay.
It is actually curable. But like we said, that the cure for kidney disease is renal transplant. All right. Yeah. So it's good to be clear on those things. That is the mainstay treatment. All right. Every single thing, especially when we get to stage 5, which we call end-stage renal disease. All right. Any other thing that we do is usually just palliative. Example is dialysis. All right. Because what the dialysis machine does is just temporarily take over the function of the kidney, cleans the blood and
outside the body,
and take it back to the body. But no other machine can do it better than the kidney.
Okay, so hold on. Let me understand. I know that there are stages. I just wanted to spare us the technicalities and complexities that surround the stages, right? But then you already said stage 5, which is the most complicated of all the stages. Is it until the patient is in stage 5 before you have to resort to the renal transplant? But in the stage 1, stage 2, stage 3, I mean, there has to be something that can be done that isn't necessarily renal transplant. Okay, tell us what those things are first.
All right, so first is to manage whatever it is that is causing, because kidney disease are usually secondary to something. In fact, when we diagnose on paper, we say kidney disease is secondary to hypertension, secondary to diabetes. All right. So it's like opening a tap and then carrying a mop to start mopping the floor. If you don't close that tap, you're not doing anything. All right. So first is to take care of whatever the causative factor is. So first is we manage the blood pressure, manage the hypertension. If there's anemia, because really and truly, if you manage these conditions here, it can halt the degradation of the kidney as it were, and then the way God has done our body is we can regenerate.
It will repair itself.
And then and that's why acute kidney injury, for example, is very curable. Right? If you take the right medication, it jumpstarts its cells back, and then you go back to normal throughout your life without even having any kidney issues. I've seen this happen over and over again. So mainstay really is manage whatever the causative factor is, and then just give palliative treatment and other things being equal.
Okay, so but in the unfortunate event, okay, I understand. Okay, we are live actually, which is why I sincerely apologize for they're not able to make that announcement. So we are streaming the show live. Apparently we're on Facebook, Mainland 98.3 FM, or facebook.com/Mainland 98.3 FM. And that's for those of you who aren't able to follow the show live. You can actually go to our social media platforms and watch the show. So that is the explanation for why that is out of the way. You have to pay for adverts. All right. So we're still back to the conversation right now. So you've spoken to us about the fact that you can still manage the condition when it is in the early stages, but when it gets to the complex stage 5, the end stage, the need for a renal transplant, what is that process like? How do you prep the individual? What is the process like, among other things? Just summarily, basically.
Okay, so we call it renal replacement therapy, which can be 2 things: dialysis 1, and then kidney transplant, the second one. The first thing is to find a donor, which is in Africa usually something else.
I know.
And because these organs function with antibody and antigens and all those blah blah blah, you need to find somebody who is compatible with you. Usually first degree family. For you to get somebody who is not a relative that is compatible is usually a whole lot. But that's one end of the process. The most challenging and the most expensive part of it is the medication that you take to immunosuppress the person, right? And they're not even, most of them are not even in Africa. You have to import them out from the country. But again, I've seen cases of renal transplant over and over again that survived, that does fine with years and years and years. But by means of prepping is to get a donor and then get those medications that you need. And then there's also the mental prep part where you need to assure the person
course.
That,
So let's talk about the aftercare, right? Because like you said, there's the possibility of, I don't want to say organ reject, but basically, that can come up. So the aftercare, and some of these medications, there might be some side effects that can be managed, of course. But what are some of the side effects that a person should expect when they go through the rigorous treatment, or they get a transplant, or whatever the case may be? Aftercare, basically, that's what I'm asking. What is that like?
All right. So again, some of the medications that we use are called immunosuppressant. So what they are supposed to do is to reduce your antibody, which are supposed to fight your infections normally.
Right.
All right. We do that so that
They don't fight the new organ. Yeah,
exactly.
see it as a foreign body.
Perfect.
Right.
So what that means is you're now more susceptible to the organisms in the hair, in the hospital, and all those things. So what you will see, but there are also medications for it, like you mentioned. But what can happen is, those infection, sepsis, and so on and so forth. And also, you're just getting a new kidney. It's not yet producing the hormones to produce blood, because like I said earlier, the kidney also has a part to play in that function. So you might also get anemia, and all those other things.
But so how long is that individual supposed to be around medical care? Because I know that even after their discharge, at home care is there, but how long are they supposed to be in a medical facility, to the point where, okay, you're fine now, you could go home and take care of yourself at home? How long is that process like?
So it's not boxed. It depends on how the person takes up the
recovery time and all.
So it's individual basis.
Give us a range, really.
Range months to several months,
depending on and how complex the situation was before they came there. Okay, so again, if you're just joining us, the conversation is around chronic kidney disease, and like I said, this is in commemoration of the World Kidney Day. It was yesterday, actually. It happens the second Thursday in the month of March every single year. And like I said, because we don't have the help program, yesterday we decided to have the conversation today, and I am in the studio with an award-winning medical practitioner. He's a medical consultant as well, and he's the CEO TSA Medicals. His name is Dr. Johnson Babajide Oriyomi, and we've been having quite a comprehensive conversation around kidney disease and everything there is to know. And I can appreciate the fact that you try to simplify this as much as possible so that the average person can understand what you're saying. So let's talk about prevention. Prevention is better than cure. Yeah. Thanks to science, there's cures, there's treatment, there's management, but then the best way to protect yourself is to prevent the incident of a disease. So how do we take care of our kidney? And please do not drag us for the things that we eat. We eat what we can eat. So please be very patient with us and our diet as Africans. And I know it's a big problem. We do not eat right. It's a primary problem we have in this part of the world. We just let's make belly stand, or how do we say that? That's what we do. So talk to us about how can we care for our kidney.
Okay, let me start by saying you are what you eat.
Even though.
All right, so I think top on the list for me is if you have a first degree family with history of hypertension and diabetes, you should take this more seriously than the average person. Because like I said earlier, 1 in 3 people with diabetes will come down with chronic kidney disease, and 1 in 5 people with high blood pressure will come down with chronic kidney disease. So you need to check early enough. Before they will say once you're 40 years old and above, you start checking your blood pressure. But nowadays we've seen and we found, like I said earlier, I've lost a couple of friends to this condition. So you need to check early. If you have a family issue, you need to check even more often, at least once in a month. All right. If you now have hypertension, you check even more often, at least once in a week. All right. Same thing with diabetes. You need to check your sugar level, because if you pick up these causative factors early enough, you can manage them, and then it does not lead to chronic kidney disease at the end of the whole day. All right. So that's 1 for me. 2 is salt intake. All right. Nigeria, we like the salt to cash the soup, or the Maggi to cash the soup. You say there's no enough salt, bring salt, let me pour more. That can work.
Oh yeah, that so you a lot of people do that. There's not enough salt, and then we just pour the salt directly on the food without it being cooked. Is that a problem?
It's a problem.
But the soup is not sweet.
These are the issues.
It's not sweet.
So question again is yes, there's a place of let the food be palatable here, but it's health is health.
So you're not supposed to consume salt in its form without cooking it. Yeah. You've heard. I'm not the one that said it. You've heard the doctor say it. You're not supposed to sprinkle salt on your food after it has been made, and even when you're cooking, it's supposed.
You use your instinct. This is what my mother told me. Just pack the salt.
Our ancestors will tell us when it's enough.
Exactly. These are the issues in Africa. But again, if for whatever reason you have a family history of hypertension, you should take these things more seriously than other people. Coach. So you need to watch it also, especially if you have a family history of diabetes. What you eat also. So again,
carrots is not sweet.
Again, veggies doesn't have to be cabbage and carrots. I think that's where we get it wrong.
Okay.
So it can be efo. It can be ugu.
Okay.
All right. So ugu should be plenty. Efo should be plenty, but small, semo, and one meat.
I don't know about that. I don't know about that. I'm not.
You know, so this thing should be in moderation.
Right.
So I think primarily, if you can pick up these causative factors early enough, it becomes easier to manage. And then again, exercise is a golden rule.
Physical activity.
Yeah,
a lot. Well, I don't think any average person is living a sedentary lifestyle right now. A lot of people are on their fit, but it doesn't matter. Are there specific physical activities that you should engage in that would help your kidney?
Yeah. So again, we get this question a lot of if I walk from my bus stop, from my home to my bus stop, does it mean that I've done exercise for the day? The answer is no. Directly. Because there's a psychological element to exercise. What that means is that you have to be conscious and you have to say to yourself, what I am doing is an exercise. There's a way that factors into the way it helps your body. And again, exercise does not mean you have to carry all the weight in the world. And we call it aerobic exercise. It's just any exercise that makes you breathe a little bit faster. So example would be brisk walking in your parlor. Walk like a marching soldier, like 30 minutes, 3 times a week, and you're good. All right, so it does not mean you have to run marathon and all those things. No. Just anything that makes you a little bit active for the day.
So basically diet and physical activity, those are the primary things that you can do to protect your kidney. Okay, so you already answered the question, because I was going to ask you necessary lifestyle adjustment, but it's still relevant in a way for somebody who has participated in, you know, poor diet, high salt consumption, lives a sedentary lifestyle. How does that person go about, you know, reorienting themselves? Because it's quite difficult to move. A person who's probably obese, who's used to consuming heavy amount of food, now this person has to start, you know, portion control, has to, I know that aside from, you know, the physical might to do that, there's the psyche in all of that. So how do you help person reorient themselves such that they now start to do things that will protect their kidneys, especially if they're heavy on the risk factors?
So again, you need to get an accountability partner, as it were, because to walk this journey alone sometimes is usually difficult. All right, so get somebody, a therapist preferably, but if you can get that, get a friend who really does care about you and say, this is the journey I'm about to work, and I need you to hold my hands. All right, and then work with that person over time. I forgot to mention two important risk factors.
Yes, please.
All right, when we were in medical school, when they ask you what are the risk factors for anything inside this world, as long as you mention alcohol and smoking, you're right. If you don't know anything, just mention those two.
I agree. All my doctors say that.
Yeah. So it is what it is. So alcohol, smoking, there are huge risk factors for high blood pressure, kidney disease, and so on and so forth. So please, if you do engage in these vices, in medicine nowadays we don't say stop, we say minimize, reduce. All right, just walk within the normal accepted range.
Is there an accepted range for alcohol? Because a lot of doctors will say just don't do it. Right.
There is actually, interestingly, there is a WHO guideline for so for male they say for beer 600 mils 2 bottles, and that's all for the day.
2 bottles a
for
day.
a female 1 bottle 600 mils beer. For spirit 2 shots for a male, 1 shot for a female. And then for wine 2 standard glass wine for a male, 1 for a female.
And you're good.
You're good.
And if you follow all the remaining guidelines to protecting your kidney, you eat right. So just on a general basis, how often do you think people should go for checkup? Because you said it that especially if you have, you know, there's the possibility that you might have diabetes or hypertension, you should visit the hospital more often than somebody who isn't, you know, at risk with the factors and all of that. So just on a general basis, how often are we supposed to go to the hospital to check ourselves? Because people, unless they're sick, they're shivering, they have a fever, they're throwing up, they would not approach a health facility at all. But just how often should we go and get ourselves checked out?
All right, so ideally every 6 months. But you know, this is Africa, you know, resources are
right.
So you can do at least once in a year, especially if you don't have family history of any of these things and nothing has been picked up in any of your annual medicals. But if you do have a family history, you need to check more often than the rest. All right, so again, you can always buy the machine at home and check by yourself.
No. I will not do that. I'm joking, but please, if you can afford it, by all means, buy the machine
and check. Especially if you have a family history. I keep on saying it because we've seen over and over again that people that come down with chronic kidney disease, when we ask and say, okay, what happened to mom? What happened to dad? What killed mom? What killed dad? There's always an history of hypertension, diabetes, and then it goes round and round. All right. So, and the earlier you pick up these things, the better. If you pick up hypertension in the early stage, trust me, you're fine and Gucci because there are medications to take. There are lifestyle modification you can adopt. Now make sure you are healthy.
Are these medications, you know, for life? Do they have to take these medications for the rest of their lives?
Yes. Yes, at a level. But again, that's why checking over and over again is important, all right? Because it gets to a level where it normalizes a little bit. I might have to wean you down the medication to reduce the dosage, and so on and so forth. So it depends on what we see, but usually, so like we say, hypertension is not curable, but it's manageable. Same thing with diabetes, so we can manage, that health condition over a period of time.
So as much as you cannot cure, the hypertension per se, you can still protect the kidney.
Exactly.
That's what's going to happen.
Exactly.
All right.
In fact, there are antihypertensive that we call renoprotective, meaning they are specifically made to protect the kidney. And if you see that as a family history of hypertension, of chronic kidney disease, those are some of the things that we'll prescribe for you.
Are younger people or older people more at risk of kidney disease? I just thought to throw that in there.
So before we'll say when you're older than 40, but nowadays we've seen that science has changed, and both young, both old, it's all around now, because there's primary and secondary hypertension. Like we all know now, we've seen a whole lot of cases of secondary hypertension,
even in young people.
Yeah, young people, like 18 years old, 17 years old. You don't even have to be in your 30s or 20s again, so.
All right then. Well, thank you very much, Dr. Johnson Babajide Oriyomi. He's the CEO, TSA Medicals. He's also an award-winning medical practitioner, a medical consultant, among many other things. And I mean the many other things. You should see his profile. It's the grace of God to just coin this out. So yeah, believe him when he tells you something. He definitely has the expertise to advise you on medical situations, and which is why it's such an honor to have had him join us on today's episode of Health Plus. This is where we will draw the curtains. Although the conversation isn't over, we're going to go on a brief break. We have another segment that would come up at about 10 minutes past 11. All right, it's just going to be a brief conversation with a family. As much as we try to talk about medical conditions, I personally like to put a human face to the conversations that we have real life person comes to the studio, talk to us about their experiences amongst other things, so that we can see that health is something that is important and we should take cognizance of it. So in about a few minutes we'll have another set of people join us in the studio, and we'll proceed with the conversation. Don't forget, at 11:30 we'd have the headline news, and then we would have conversations with Enterprises Health Show. That's a 30 minutes program that comes up, and we'll be talking about women's reproductive health. That's what we're going to focus on, but we'll go on a break right now. Dr. Johnson, such a pleasure having you. Thank you so much. Hopefully someday soon we're able to have you again, talk about another condition. Well, that's it for that particular conversation on chronic kidney diseases. We'll go on a break, but we'll be right back. This is still Health Plus on Mainland 98.3 FM. My name is Sage Babalola.
Knowledge is power. Information is key. And that is why we aim to unlock the doors of opinion, unveiling the stories that need to be told. Join Omobola Sandra and Sage Babalola on the Morning Express on Mainland 98.3 FM from 5 a.m. to 11 a.m. as we invoke the thought-provoking discussion, tackle the tough questions, challenge assumption, and give a voice to the unheard. This is the Morning Express on Mainland 98.3 FM.
On the Morning Express.
Good morning.
When the airwaves in your market become more and more crowded. It's time to break it open and really stand out. Broken Air is here.
On Mainland 98.3 FM, the sound of Lagos.
Man, I've been fighting this battle with demons inside of me. I just won't stay in my lane so nobody can bother me. I'm too sensitive, it's man catching me ego. Thought I had it till someone told me I had to go rap for me. All along, all of them be jealous. Fake souls, so it's make me nervous. Out of here, I'm on my peppers. Pull me down, still I'm breaking records. I'm on 1,000, but they wanna take me to 0. Fearless nigga, only God is my hero.
That you angels cover me every day, cover me
let the devil emerge. My spirit is broken, somebody can take me to church. Mama told me, boy, I'm proud of you. Don't you let nobody lie to you. Jehova, blessings will carry you. Anywhere you go, the power will follow you. When I was losing.
Follow us on all our social media platforms on Instagram, Facebook, and YouTube at Mainland 98.3 FM, on Twitter at Mainland FM. We are the sound of Lagos.
Welcome back. You're still on to Mainland 98.3 FM, the sound of Lagos. My name is Sage Babalola. Before we went on that break, I did tell you that I like us to put human faces to the conversations that we have on a radio so that you can hear the real life experiences of people, understand the situation, understand the need for us to prioritize our health, and most importantly, the ministry of community, how we can come together to ensure that we have a healthier society and by extension a wealthier society. Well, I do have a family here with me live in the studio. You can actually see them if you're on our live stream, as we are streaming the show live on our streaming platform facebook.com/Mainland 98.3 FM. I did say that we have a family here with us in the studio. They are the parents of Ebooluwa David Demori, who has a heart condition, and of course there is need for surgery to take care of it. You know, cardiovascular conditions are very complex and they're very expensive, and we decided to, of course, play our own role, do what we can to draw attention of the community, of the public, to this particular specific condition of Ebooluwa David Demori, and how we can help this child attain full health. We're going to have a brief conversation with the parents so that they can they're in the best position to explain the experience as the primary caregiver. So we're going to hear from them today in the studio. Good morning to you. How are you doing today?
Good morning.
I'm going to need you to speak up, please. I apologize. Please, I need you to project. Good morning.
Good morning.
Yes. So please introduce yourself. I know his name, but I don't know yours. Introduce yourself, please.
My name is Tᴏɪᴛᴛᴇʀ David.
Okay. And you are?
My name is Tᴏɪᴛᴛᴇʀ.
You're the father and the mother of the child. So just talk to us about how all of this started. First of all, let's know, when did you notice that Ebooluwa had a problem with his heart, and what are the experiences that you've gone through so far to the point where you now have to have surgery for young Demori here?
It's right from birth. After giving birth to a maternity center, so the third day we began to hear the way he was breathing. He was not breathing as a normal. He was breathing heavily at just 3 days old, which is not okay. So then we decided to take him to an hospital, which is an Iṣemo hospital. So on getting there, they run a test on him, and it was discovered that he has a hole in the heart. So since then we have been managing, though actually it has not been really easy. We have been managing him being at a younger age, 3 days old. So when he was 2.5 years old, he fell sick again. So we decided to take him to a general hospital because the Iṣemo said the surgery does not cover. So we have to take him to a general hospital at Bagada then. So they did a lot of tests, echocardiography, ECG, and it was also discovered that he have a hole in the heart. So since then, 2021, we have been seeking for help up and down for the surgery.
For him, yeah.
We also went to last week also.
Okay.
To do the same thing.
How old is he though?
He's 5 years old.
5 years old. So this is congenital right from when he was born. You've been managing this, and now there's a need for surgery. Heterotaxis syndrome, a hole in the heart. So for the surgical procedure, what is the estimate of the amount that is needed for the surgery?
Okay. Actually, we meet an NGO.
Okay.
So with the help, I'm not sure if I can mention his name.
No, there's no. Just tell us how much
So
it
he
cost.
assisted us to get the cost of estimate from India, and it was last year $13,052
In naira, please.
in naira. I can't say it in naira.
Okay, I understand.
Naira
It's
is
okay.
not stable.
It's okay. I understand.
mean,
But basically, I'm seeing here about 13 million naira, and there's a 13.3 million naira as at last year. So with the forex crisis and all, it probably would be as much as 15 million, 15 to 17 million naira. So basically, in all of this, what we're trying to establish here is that there's a young child here who is 5 years old, has a congenital condition right from when he was born, heterotaxis syndrome, or to simply put it, there's a hole in his heart. You can understand how complicated that can be for a young child. Even as adults, we know how complex it can be to manage certain health conditions. You understand the importance of the heart. That's primarily the center of our being. That's the core of our being. So for a 5-year-old who has a hole in his heart, you can understand how I'm trying so hard, how difficult the experience can be, especially for his caregivers who happen to be his parents. So we're asking that again, as a community, we come together to help this young child go through surgery. We can treat, we can manage, but then it's best to take care of the condition, take care of the primary cause, which is to repair the hole that is in the heart. And so we're calling on the community to join hands together and see how we can help this young child. So what I'm going to do now is allow you the liberty to give out your phone numbers. So some people would rather have conversations with you personally than call into the radio station. So let us have your phone numbers. So if there's anybody that would like to contribute, you heard as at last year was about 13.3 million, but we're all aware of the forex crisis. This is a surgical procedure that's supposed to happen in India, right? And so the money has upped to about 15 to 17 million. It probably would be more depending on the rise and fall of the naira. So this is about 17 million naira that is needed to take care of this young child, David Tᴏɪᴛᴛᴇʀ, that's his name. So if you would like to be of help to the parents, they're going to give out their phone numbers so you can call them and do anything that you can. So please, sir, let's have your phone numbers.
my phone number is 080.
I can barely hear you.
Okay. 080 5984 3665. Once again, 080 5984 3665.
Right. Okay. I want to hear from the mom, and I can understand why she's very quiet. There's an emotion behind all of this. I 100% understand why she's very, very quiet, but still, I want you to participate in this. And I know that it's tougher for you because, you have to see this every day. To watch your child go through this difficult experience is hard. It's really difficult. I can tell because I've catered to someone before. Just, talk to us. Let people hear from you so they understand why we need to come together to do something for young David here with us in the studio. Please, let's hear from you, ma'am.
Yes, I didn't have anything to say, but I just want to beg the society that should help us. Whatever they have, they should donate it for us. But because it is very hard, as it is, I always carry him to school. So it's very difficult for me to. It's very difficult for me to manage it. But I just want to beg the society to help me about it. It's from birth, so I've been
5 years.
So
Yes, 5 years old.
now he's now 5 years old now.
I can hear him breathing and I can understand what you're saying. I can't hear him breathing and I can understand what you're saying. You might not be here, but I'm here and I know what I'm seeing and I know what I'm hearing because I can hear him breathing into the microphone, and that's not how he should be breathing as a 5-year-old. And 5-year-olds want to be active, they want to play, but then to have to force them to be in one space so they don't overwork, so he doesn't overwork his heart, that's difficult. Trying to isolate the child, trying to protect the child is tough. So let's help David here live a normal life as a 5-year-old, play with his friends, go out without his parents being worried, amongst other things. So please, once again, you're going to have to give us your phone numbers, and I need you to call out the phone numbers slowly so people can hear you. So call out your phone numbers once again, and all of this is just in a bit to raise money for young David here to have his surgery in India. He has heterotaxis syndrome, or a hole in the heart is what he has. So please, sir, go ahead. Your phone numbers once again.
My phone number is 080-5984-3665.
Again, please.
080-5984-3665.
All right. Well, thank you very much for calling. Unfortunately, we're out of time, and this is how long we can accommodate you for. But I'm really hopeful, and I hope that young David here gets the treatment that he deserves, and you're able to raise the money as soon as possible so he could go to India and have his surgical procedure. Thank you so much for coming. I empathize with you very deeply. I see what's happening here, and we're streaming the show live so people can actually see what we're seeing. And let's hope that this interaction is going to yield results that would help young David here get the treatment that he deserves. Have a fantastic day. It was nice to meet you. Thank you so much for coming to the studio. We'll keep doing what we can. Thank you. All right. Well, we're going to go on a break right now so that we can give room for the next segment of the show that we're going to have at 11:30. We would have the news bulletin at 11:30 a.m. and then right after that we would have the Enterprises Health Show that comes up 11:30 all the way to 12 noon. This is where we speak to Dr. Akpabio and Famavis about certain health conditions. And I told you earlier that today on the show we'll be talking about reproductive health of women. We'll highlight the challenges, how to prevent it, and more importantly, how to take care of it in the event that it's already occurring. My name is Sage Babalola. Please don't go anywhere. You're still listening to The Sound of Lagos, Mainland 98.3 FM.